Hello, my name is Banjo. In this video, I'm going to be demonstrating sterile gloves and urinary cathtere insertion. To start with, I've been able to verify the PCP order with the patient care plan. And the next thing is, I've been able to gather my supply and equipment, which are 1 pack of Foley cathtere tray, 1 pack of sterile gloves. Then I have gloves. Now, in my patient's room, hello, my name is Banjo, a student nurse from Mountain View College. I'm here to insert your urinary cathtere. Can you please verify your first and last name for me? Jackie Smith. Thank you, Miss Smith. Can you verify your date of birth? 03/07/1972. Thank you, Miss Smith. Miss Smith, before I go further, do you have allergy to latex or betadine? No? Very good. And to let you know, today I'm going to be inserting your urinary catheter in a short while. Now, I have been able to identify my patient. I'll provide privacy and I'll cover her, use a gown to cover her body, and I'll only expose her perineal area. Because she's a female, I'm going to be folding her legs and opening the legs so that I'll have enough working area, and I'll do that to the other side. In case it's a male, it's going to be different. They're just going to have their legs straight up, but this is a female. Now, I'm going to perform hand hygiene and I'm going to be getting myself ready. In sterility procedure, I'm going to let you know that I'm working with my surface within my hips and my shoulder because I don't want to break sterility rules. The surface, the bed has been adjusted to my waist and my shoulder, so I won't be going beyond my waist and shoulder in what I'm going to do. Now, first thing I'll do is I'm going to be opening my Foley cathtere pack because I will need the pack as my trash bin. Okay. But don't let me forget, I have to validate what I'm using. I have to make sure that there is expiry date is not over for the pack. I've been able to see that the Foley cathette is going to expire on 3rd March 2022, which is good, and the glove is going to be expiring on August 2022, which is also good. So I'm going to be placing the pack at the feet level of my patient, or feet level of the bed. Then I'm going to be taking out this, and I'll open this. I'll have make sure the surface is clean. I will have cleaned the surface. Then I'll be opening this. Now that I've been able to open this, I'm now going to go ahead. Before I can touch this, I want to make sure my hands are sterile. So I'll be opening my sterile pack. And I'll be dropping this one in the trash here. I'll make sure I don't go beyond my hips. So I'm going to open this right here. Now, I'm going to be using my non-dominant hand to fix my dominant hand first. So I'm going to be holding this at the tip in order for me to be able to wear this. I'll make sure I pull it past the wrist. You can see it's not perfectly fixed, but I'm going to leave it. I will adjust it later. Now that this hand is sterile, I can use this to pick I'll make sure I pull it past my wrist. You can see I'm still not going outside the sterile section. Now I can use the sterile hand to fix this one. Now that this hand is to fix the dominant hand. Now my two hands are sterile, so I'm going to be dropping this, but I'll make sure I didn't go beyond my hips. So I'm just going to drop it. Now I don't need this. I'm going to take it out. And this I don't need either. I'm going to take it out. And I need this one. It has two sides, the plastic and the paper side. So I'm going to be opening this. The plastic side will be going to the bottom, while the paper side will be at the top. So I'm going to have it this way. And I'm going to be putting it under without my hand touching anything, any part of the body. I have been able to fix my pad under my patient. Now, coming back here, I don't need this either. I'm going to take it out. And here is, I don't need this. I'm going to take it out. I don't need this either. So I'm going to be taking out the tray, put it this way, and I'm going to be pouring my iodine. I'm going to be pouring my iodine. I'll pretend I've opened the iodine, and I'm going to pour it on the cotton ball this way. Then I'm going to drop this. I'll make sure I didn't go beyond my hips. Then I'll have my forceps nearby. I have my lubricant and I have my syringe. I don't need this. I'm going to take it out. Then I'm going to take off this. So what I'm going to be doing next is I'm going to put a little of the lubricant here. So I'm going to quickly lubricate to tip of the cathette. I don't need this, and I'm going to put this here in the coiled form. Now the next thing I'll be doing is I'll be putting my 10 ml syringe. I'll be fixing that. I'll remove the cap and I'll fix it to the cathette in order to blow the balloon. So now I'm ready to start cleaning the perineal area. My dominant hand is the clean hand. I'm going to be using my non-dominant hand, which is my left side, to open the labia this way, and I'll have my forceps and I'll start cleaning from up, outer, here, outer, here, from the top, outer, top to the middle, outer, from top to the bottom, outer. And I've been able to do the cleaning. I'll still have my dominant hand is clean. I'll still have my non-dominant hand of the labia, and I'm going to move this back here, and I'm going to be grabbing my cathette at the tip, and I'm going to insert with my clean hand. I'll start inserting until I see urine. I'll insert like 2 to 3 inches until I see urine. Now I've done with insertion. I've completed my sterile. Now I can release the labia. My hand, I can now blow the balloon. So I've been able to blow the balloon with the 10 ml syringe sterile water. So I've been able to blow the balloon. Now I'll take out the syringe. Now I can now provide safety by taping with non-allergic tape to the leg. I'll tape this to the leg. Then I'll make sure I hang the tool to the non-movable part of the bed. So I've been able to hang the tool and I'll be able to provide safety. Then I'm now free to take off my sterile glove. So I can now pack all this and clean my working area. I can pack all this and clean the working area. Now, for me to remove the cathette, what I'll do is I'll place a clean, first thing is I'm going to perform hand hygiene. I'm going to verify my patient again in order for me to see what the instruction is to remove, I'm going to identify my patient looking at her first and last name, Miss Jackie, thank you, and date of birth, thank you. I've been able to provide that. Then after I've done that, I'm going to I'll perform hand hygiene and put on a new glove, put on a clean glove. Then I'm going to be placing the waterproof pad under her bed. I'll put a waterproof pad under her bed. So after doing that, I'm going to empty the urine tubing into cathtere bag. I'm going to empty the urine into cathtere bag. An empty bag. I'm looking at the color and the odor of the urine. Then I'm going to remove the tape. I'm going to remove the tape on her leg. Then I'm going to deflate the cathtere with the 10 ml syringe. Again, I'm going to be needing my 10 ml syringe. I'm going to use it to, you can see the water is going back in by itself. So I'll withdraw I'll deflate the balloon that I already inflate. Then I will ask my patient to take a deep breath because I want to remove the cathtere gently. So I'm going to make sure I carefully, I'll tell her it's not going to hurt you, and I'll make sure I remove it. So having it here, I'll look at it right here and this way. Then I'm going to clean the perineal area. I'll form my hand hygiene. I'll put a new glove. I'm going to clean the perineal area and then I'll place my patient back in a normal position. I'll adjust the bed and that's it.